Hi, I'm Alicia,
And I'm Annie.
and we're dental hygiene students here to talk about spinal cord injuries.
Here we will discuss what a spinal cord injury is, the types of injuries, and how we as hygienists can help accommodate these patients and provide effective oral hygiene care.
So what is a spinal cord injury? A spinal cord injury, or the spinal cord is located inside the center of the spine and stems from the brainstem called the medulla oblongata down to the lower lumbar region where it becomes cone-shaped and is called the cornus medullaris.
It is one of the main components to the nervous system and works by sending messages from the brain to the rest of the body. It controls body movements, reports senses to the brain, and manages your reflexes.
The spinal cord is made up of three main sections: the cervical, thoracic, and the lumbar region.
Layers of meninges cover over the spinal cord and is surrounded by protective tissues, the dura mater, arachnoid mater, and pia mater.
There are many injuries that can happen to the spinal cord that range from diseases to traumatic physical accidents. Depending on the severity, depends on the side effects.
There are two types of classifications of damaged spinal cord injuries, which are complete and incomplete. It means that wherever the lowest part of the damage to the cord is determines its effects.
A complete injury is when all feeling and motor function below the injury site is gone. The damage is complete. However, if some sensory and mobility is still there, it is classified as incomplete, and this can vary depending on the injury.
The term tetraplegic and paraplegic represent what extremities and body parts may be paralyzed. Tetraplegic can be characterized by not having any function from the neck down, and paraplegic is usually the trunk down, but not including the arms.
Some characteristics of a spinal cord injury are paralysis, loss of sensory functions, loss of bowel and bladder control, respiratory dysfunction, spasms, and pain where the injured nerve is and what it controls.
A patient with a spinal cord injury may be in a wheelchair that they can control or may have a caregiver who helps them around the clock. This may be something that a clinician will learn to adapt to in the office when treating these patients. The hygienist can offer to help the patient transfer from the wheelchair to the dental chair or can attach a mobile headrest to their wheelchair to allow treatment if it is more comfortable for the patient.
Depending on if they are bedbound and unable to come into the clinic or if they're able to travel and come in, can affect their care. Sadly, there are not a lot of resources for dental home care visits for those who are homebound. In a few instances, hygienists can make visits to homes or facilities to provide care.
But in most cases, access to care is a big barrier for these patients. They most likely have a caregiver who helps them with everyday tasks, and helping educate these healthcare workers on how to provide adequate oral hygiene care for their patients is essential to the patient's health.
Some of the recommendations that hygienists can make to these patients to make daily oral hygiene care easier could be to suggest attaching a tennis ball to their toothbrush to allow for an easier grip or extending the handle of the toothbrush. They can also try using floss picks to floss if they're unable to use string floss. It is also important to know the effects of their possible medications and its effects on dental treatment.
Something to keep in mind for these patients is that they are at high risk for pressure sores, so changing their position or providing chair padding is a way to help prevent that from occurring or alleviate the irritation of one already present while you are caring for them.
In the office, some of the best ways to accommodate spinal cord injury patients would be to have a large walkway and doorway to allow wheelchair access, have an easy dental chair to get in and out of, and also have freestanding lights if they prefer to stay in a wheelchair.
These are just some of the recommendations that dental hygienists can make to better treat spinal cord injury patients. We hope you enjoyed this presentation and learned a lot. Thanks for watching.